Well, I can start actually, because we don't need the slides for this. So I was just going to introduce you to alcohol availability, but you all know exactly what that is. So just to recap, there's two main types. Well, actually, what is alcohol availability? Really, it's how easy can you get your hands on alcohol. Two types: physical, which means how close are you to the nearest outlet? You know, what's your age? Are you under 18? What are the trading hours of the local venue? And economic availability, which is really nifty, and that really relates to your disposable income as it relates to the price of your beverage that you're trying to purchase. And of course that's affected by, well, let's zoom forward now, discounting, tax, and, as we'll hear in a little bit more detail from me, minimum price. So why does availability matter? Well, it matters, frankly, because decades of scientific research evidence support the conclusion that as availability goes up, so does consumption and so do related problems. And in the reverse, as availability falls, use falls and problems decline. Now, there are levers, wonderful levers that policymakers and decision makers have at their disposal which aren't used often enough, as we heard from Steve. And I've only picked three because that's all I have time to talk about. And I've left off the 21, the older legal minimum drinking age, because as Steve says, it's a tough nut, that one. But the thing that gets raised a lot, particularly around liquor licensing matters, is outlet density, the placement and the number of outlets. But in truth, the relationship between outlet density and harm is much more complex than counting up numbers of outlets in an area. We really need to take into account the variability between outlets. A large discount store with huge discounting capacity, enormous numbers of brands, would have much greater influence on the purchasing habits of the local neighbourhood than, say, a small boutique bar that only sells wine. And it's also true to say, I think, that the alcohol research field, and myself included, we've overlooked and underestimated the contribution made by off-outlets. And Steve mentioned pre-drinking, and we have some evidence now that a lot of the harm that occurs at on-premises, like bars, pubs, nightclubs, is related to people who purchase cheap alcohol at an off-outlet and drank to intoxication before they even went out. So dealing with all of this variability requires modelling, and it requires the best data possible, and Diana talked about that. It requires data on the outlets themselves, sales data, and it requires the harm data, all to be linked together and stuck into lovely models. Trading hours. Some of the strongest evidence around restricting trading hours actually comes from Australia and Perth, and as you've seen, Newcastle as well. And basically they show, you've heard this, that when trading hours are longer, we get increased harms related to intoxication, like violence and drink driver road crashes. When you reduce those trading hours, we get fewer problems. But extended trading hours, not to be confused with lockouts, which are a different kettle of fish. And I think actually Diana has a new paper on that. I might be right, yes. But we're not going to cover that right now. Next, price, zooming along, is an extremely powerful lever. The evidence for price effects, there's over 130 papers around this. It mostly relates to taxation impacts, but we know that a 10% increase paid by consumers leads on average to a 5% reduction in consumption. Not just for, and it includes everybody. That includes heavy drinkers and young drinkers, problem drinkers, and what follows, of course, is a reduction in alcohol-related injuries and illnesses. Now, alcohol taxation is behind most of these studies, and it's a common means of adjusting price, but there is a new kid on the block, and we've talked about it. It can either be used as a standalone strategy or one that complements policies such as volumetric taxation. And by the way, volumetric taxation is not something we currently have in Australia, but this is clearly the domain of the feds and not something we can actually influence here at a discussion about state-based controls, but certainly something worth considering. But what I'm talking about is minimum pricing, MUP, we call it. A very hot topic. We've all heard about the Northern Territory looking to introduce a $1.30 minimum unit price soon. I'm not sure about the timeline. So what is MUP? Quite simply, it's where the government sets a minimum price below which alcohol cannot be sold at retail. The effect on the retail price of different beverages depends very much on where the floor price is set, but it always affects the cheapest beverages first, which is extremely handy from a public health point of view because these are the same beverages which attract the heaviest drinkers. So let's have a look at why that is. On the left here, we can see current prices. I just took these from various websites. And we can see that they're sort of arranged in increasing price per standard drink. Cask wine is at the bottom. Clean Skins is actually not much far ahead either in terms of price per unit, price per standard drink. We can see that if we introduced a $1.30 minimum unit price, the price of all these wine-based beverages would go up, but the beer and the spirits and the cider wouldn't be affected because they're already sitting at $1.30 on average per standard drink. On the other hand, if we chose to do $1.50, we then managed to include beer and spirits, but not nearly as much as cask wine, which would be going up by about 5 times the price. Of course, keep in mind that the reason why wine is such a great candidate for influencing with MUP is because it receives the wine, it's affected by the wine equalisation tax. It's treated much more kindly by the tax system than all the other beverages. And I suspect that if the federal government removed the wine equalisation tax tomorrow, this table would look very different. Right. So actually I've gotten ahead of myself. So why is MUP a good idea? Well, it's a good idea precisely because it increases the retail price of the cheapest beverages but leaves basically the others unaffected. So it actually has a very targeted action on the heaviest drinkers who prefer to spend less per standard drink, and it leaves the majority largely alone at small effects. But for the same reason it affects lower priced beverages, minimum unit price is often subject to the counter-argument that it penalises the poor. So let's take a look. I borrowed this figure from my colleagues at Sheffield University in the UK, where they've done some absolutely fantastic work modelling hypothetical MUPs on the UK population. And this one basically, shows us, what would happen. So the hypothetical is 45p, so a standard drink set at 45p, which I'm guessing is less than $1 Australian, maybe about 90 cents, right? And it's showing the extent to which different segments of the population, different levels of drinkers with different types of income, already purchase at below this minimum price, right? So we can see these green folks in here. These are the vast majority of us who drink at moderate levels. Very few of us actually purchase much at all that's under a minimum unit price of 45p. But by comparison, you can see that the harmful drinkers are purchasing very large quantities of their overall consumption under the minimum unit price. So these people, especially the ones in the low income column, are mostly affected by that minimum unit price. Now, clearly, there is something going on here in relation to income. Having said that, if you model what this reduction in consumption from minimum unit price would produce, the estimates are that these heavy drinkers in the lowest income area would drink up to 30 bottles of wine less a year. And the higher income heavy drinkers more like 3.5 bottles of wine because they can better absorb the price increase because they're on higher incomes. And even though this looks like, an unfair approach which would affect the poor the most, the vast majority of the benefits of this MUP will actually accrue to this very group. So they actually receive 80% of the benefit of the reduction of deaths, hospitalisations and improvement in quality of life accrues to this very group. So it's not actually as regressive as some would argue. Recommendations. My recommendations, in a nutshell, use local level data to model effective evidence-based responses to liquor licensing matters. And as Steve said, give the community a better go at having a bash at being involved. It's pretty tough for communities to get involved in liquor licensing matters. Resist lengthening standard trading hours. Late trading permits really should be seen as a privilege rather than a right, and they should be shut down when problems occur. But to know that, you need to monitor. And introduce minimum unit pricing with regular adjustments for inflation. And I've added here that we should consider the feasibility of coupling that with a public health and safety charge. I'm not going to call it a levy or a tax because that's federal domain. But the problem, one of the problems with MUP is that the generation of the extra money spent doesn't actually accrue to the Treasury. It goes to the liquor industry. And it's not as much as you might think, but it would be nice to know that some of that windfall would be going back into treatment and prevention services. And one last thing I'll leave you with is that MUP is not necessarily a competitor or should be used in place of a volumetric tax. They actually complement each other beautifully. And if we could do both, if we get the feds to line up with the state, that would be fantastic. Thank you.